Hi, I'm Dr. Christy Sutton. Thank you for joining me today. We're going to talk about immune genomics and epigenetics. So let's dive right in. Here's the disclaimer. This is for educational purposes only, not intended to diagnose, treat, or prevent diseases. So today we're going to talk about a lot of important topics. We're going to spend some time talking about autoimmune diseases as they are on the rise. We're going to be talking about some key genes that are important to know about for immune health and that can play a role in autoimmune diseases and general immune problems. We're going to be talking about one of my favorite topics. I'm going to talk about how iron influences the immune system and how it's very important to understand and correct the iron-related issues. And we have a lot to talk about for the next hour. So please stay tuned and let's focus and pay attention to what's going on. So, okay, autoimmune diseases are on the rise. So 50 million Americans have one or more autoimmune diseases, and that is probably undercounting. Truly, if you were to do more thorough diagnostic panels on autoimmune diseases, you would likely see a much higher number of people with autoimmune diseases. A lot of people that have an autoimmune disease do not get diagnosed, and it takes decades for them to often get diagnosed if they ever get properly diagnosed. And so if we say 50 million people in America have autoimmune diseases, then the number is likely much higher than that. Now, what we do know is that women are more likely to have autoimmune diseases than men, and there's multiple reasons for that. One is that going through the menstrual cycle, the monthly menstrual cycle, and the hormonal fluctuations, especially of estrogen, are a contributing factor to autoimmune diseases. And then the other reason is pregnancy. Pregnancy is a big autoimmune trigger. Often women will develop an autoimmune disease either during or after pregnancy because of the huge hormonal fluctuations. So this is important because a woman who develops an autoimmune disease during pregnancy, or that has an autoimmune disease that's not under control at all during pregnancy, it can affect the health of their child, and that has been shown to increase the rates of autism and various health problems. So it's important to have an autoimmune disease well under control by removing the triggers and really supporting the immune system as much as possible going into and leading through pregnancy. That's another reason that you want to be as healthy as possible going up to and throughout pregnancy, so that you're less likely to get sick, you're less likely to get an autoimmune disease. Getting a virus is a big trigger for an autoimmune disease. Just the other day, I had a woman come in that, she developed an autoimmune disease during pregnancy. This is not an uncommon thing. She got COVID. She developed gluten ataxia, which we're going to talk more about today. Because for me, celiac disease is a crucial topic, and I'm going to talk more about that today. So finishing up with this slide information, we got all the different countries, but, North America really has a fair number of autoimmune diseases. Europe, Asia, Middle East, Latin America. What this is important telling us is that pretty much in every part of the world, but especially, North America, Europe, there's an increase in autoimmune diseases. And we know that really developed first world countries, you're more likely to have an autoimmune disease than in third world countries. And part of that goes back to the hygiene hypothesis, which, if you're not familiar with the hygiene hypothesis, it's not really a hypothesis at all. It's actually proven fact that if you are raised and live in an overly clean, sterilized environment and not exposed to as many bacteria and viruses and stuff like that, then your immune system, it just starts going after everything, and it's going to find something to go after. And whether that's a benign pollen or your thyroid or your intestine, who knows? But certainly it's important, especially in those early days, and we've talked about this in other workshops with you. I've talked about this in other workshops with you. It's important, especially in those early days. By early days, I mean like the first days of one's life, to make sure that you are being exposed to good bacteria, have a good microbiome, and really setting the stage. The microbiome is crucial for autoimmune development and prevention, and we'll talk more about that. So what is an autoimmune disease? I know you guys probably know this, but it's helpful to kind of go over it. And the way I describe this to patients is I describe it as a friend versus foe situation. So your immune system, it loses tolerance to seeing its own tissues as a friend. And often that happens when we're dealing with some big immune trigger. And this large immune trigger really riles up our immune system and really gets our immune system going. And then it's kind of like, if these soldiers are going out to war and they just are overworked and they're underrested and they get tired and they start making mistakes and they stop seeing the enemy, being able to differentiate between the enemy and the friend. And instead of going after the invader, bacteria, virus, parasite, they start going after the friend, the thyroid, the myelin sheaths as in MS, the intestinal lining as in Crohn's and colitis, the joints as in rheumatoid arthritis, and so on and so forth. And so there's many different types of autoimmune diseases. They have different names based on what they're attacking, but the underlying mechanism is more or less the same. And that is that your immune system has lost tolerance to seeing the difference between friend versus foe. And so there's some autoimmune diseases that are more likely to affect the digestive system. There's many that are, don't technically affect the digestive system. And then there's many that they are not technically digestive, but they still incorporate some digestive components. So the name depends on what tissue they're affecting. And unfortunately, what I have seen is that often what happens is people, once they get diagnosed with one autoimmune disease, it's often, if you kind of really do a good workup on them, you realize, oh, actually you have 2 or 3 autoimmune diseases, and the second or the third just was not diagnosed properly like 10 or 20 years ago. And then not only that, but now we're saying, okay, you have this autoimmune disease that's been diagnosed with whatever it is. Let's call it Hashimoto's. Let's say you do, a reasonably thorough blood test and you realize this person has Hashimoto's, and okay, they have Hashimoto's. Their immune system's attacking their thyroid. And so many doctors would say, oh, you know what? That's not that big of a deal because if your immune system attacks your thyroid, you just take thyroid hormone, no big deal. Why is that wrong? That is wrong because Hashimoto's is an increased risk for thyroid cancer. 1, but 2, while you can just take thyroid hormone, if you don't diagnose and find the underlying triggers for that Hashimoto's autoimmune disease, then you're not fixing the underlying problem, and you're not fixing the immune system's inability to see friend versus foe. And now what you're doing is you're basically kicking the can down the road for that person to deal with the second autoimmune disease and the third or the fourth. And while Hashimoto's in and of itself, as our example, maybe is not the worst option out there, MS is quite detrimental. I don't know a doctor out there would say, oh, you have MS, no big deal. Just, get used to living in a wheelchair. Or Crohn's disease, Crohn's disease, no big deal. Just, get on immune suppressants for the rest of your life and it might kill you, and have parts of your bowel removed. No autoimmune disease is okay. Some are more detrimental to one's health than other, but they all are big warning flags that there is something big going on here and you need to figure it out. You need to find the trigger. So for the purposes of this slide, some autoimmune diseases that are known to really be digestive in nature primarily are Crohn's, ulcerative colitis, celiac, type 1 diabetes, which affects the pancreas, which is still part of your digestive system, intrinsic factor antibodies, which affects the pyloric cells, which is part of your stomach. And so you don't make intrinsic factor, which means you're going to be in low in B12. Celiac is thought to be digestive, but as we're going to talk about, it's not just digestive. It also largely affects the whole body, neurological system, skin, everything. Crohn's, ulcerative colitis, inflammatory bowel disease. Some other autoimmune diseases that are not classical GI autoimmune diseases, but still have GI components, which, like I said, every autoimmune disease has some GI component. Addressing the digestive system is in some way important for every autoimmune disease, because a large part of our immune tolerance and what drives us to or away from autoimmune disease is a healthy digestive system, which I'm going to talk more about in a minute. But lupus, which, if you have lupus, you have positive anti-nuclear antibodies, and rheumatoid arthritis. A lot of people with rheumatoid arthritis will still have digestive issues. Scleroderma. With scleroderma, the immune system scars up the esophagus and the digestive lining, and then you start getting more issues with constipation, inability to prevent candida overgrowth, and SIBO and stuff like that. Sjogren's affects the digestive system, the glands. You're not going to be making as much saliva. Ankylosing spondylitis, it affects not just the joints, but also the bowels. Multiple sclerosis affects the myelin sheath. Anything that affects your myelin sheath is going to affect your digestive system, because what controls your digestive system is ultimately your brain and the myelin sheaths. Eczema, a lot of skin issues, as we know, stem from gut problems. One reason we're seeing so many eczema type issues in kids today is because their guts are so bad. Hashimoto's, thyroid, technically still commonly triggered by digestive system issues, gluten, dairy, etc. Guillain-Barré, peripheral nervous system issue, commonly triggered by an infection or a vaccine. I guarantee you, you're going to find digestive issues in almost all of these people prior to them developing Guillain-Barré. This is why you want to make sure you're as healthy as possible every day of your life, especially the days that you're dealing with a virus or a vaccine, because you don't want to push yourself towards that autoimmune disease that can occur with an infection or a vaccine. Pretty much any other autoimmune disease. So let's move on. Okay, so let's see. I woke up this morning, and I'm going to digress here for a second. Forgive me. I woke up this morning and I get on Facebook and I see this Facebook group that is really a pretty sophisticated group. And this girl asked this question, what are the celiac genes? And then I see the answers, and the answers are just so wrong. And the answers were things like, well, the most important one is DR7, which is not a celiac gene, and you have to get this IgA test to test up positive for celiac disease, which is not true. And here are the genes, but really it's not very valuable to do the genetic test, because most people with the genes don't get celiac disease. And so, all of these things are just going in my head like, wow, this is a sophisticated group and they're clueless. And so I decided, okay, well, I have an hour to educate people today, and I'm going to teach them more about celiac disease. And those of you that have known me and followed me and, listened and maybe learned from me, hopefully, that this is a topic that's near and dear to my heart, because I have celiac disease. I have the celiac gene. I pass it down to my daughter who has gluten sensitivity at the age of 4, trying to prevent her from having celiac disease. I got celiac gene from my mother, who I'm convinced ultimately had schizophrenia as a result of celiac disease being undiagnosed and untreated, because celiac disease does affect the nervous system. And in 2/3 of people, it actually just affects the nervous system and does not cause digestive issues. I have looked closely at hundreds and hundreds of genetic tests of people and seen their history and put them on a gluten-free diet and seen how their, labs and their symptoms change. And so I have thought long and hard about this. I've studied, I've written about it, I've taught about it, and I have a thing or two to say. And I decided I'm going to use this platform today to just kind of give you a little bit more about celiac disease. But before I do that, I need to give this slide a moment too. I think I kind of jumped the gun here, so forgive me. But before we talk about celiac disease, let's talk about what are the triggers for an autoimmune disease, because this is really important, because any autoimmune disease is going to have a trigger, and often it'll be more than one. And this is the hard part. The triggers are what are the environmental factors that pull the trigger on turning on these autoimmune diseases. So there's autoimmune disease genes, like celiac disease is a huge one. That's why I want to talk about it today. I think it's one of the most important genes to know about. And if you really want to prevent autoimmune disease in somebody, then you really need to know if they have this gene, because they're very high risk, not just for celiac disease, but for many other autoimmune diseases. But ultimately, it's these environmental factors that are going to pull the trigger. For celiac disease, gluten's a huge trigger, but it can be any food. It can be, not just gluten, wheat, etc. It could be dairy, soy, it could be corn. It really can be just about any food. There are some that are more problematic than others. It can be stress, emotional trauma. This is very common. It's not unheard of, or unexpected to hear somebody say, oh, I went through a divorce or a death of a loved one and developed an autoimmune disease. Well, stress is hard to quantify, and we can't, give you a lab test and say, oh, yeah, well, I guess we can if we look at your cortisol and your DHEA, but it's not as easy to quantify as like, well, your stress is doing pretty good today on labs versus your stress is really out of control. Stress is a serious issue. It's a serious environmental trigger for our nervous system. And we have to have ways to manage and understand that. But it's not just stress like the stress, divorce, etc. It can also be overtraining, not sleeping enough, surgery. It's common for people to have a surgery and then, develop an autoimmune disease after that, because this huge stress on the body. That's, I think, another reason pregnancy can be a trigger, because often women will get surgery, C-section is a surgery. So not only do they go through these huge hormonal fluctuations with estrogen, and then just, it's this huge stress on their body, just emotionally and physically, but also then you add like surgery to the mix. No wonder all these women are getting all of these issues with autoimmune diseases during pregnancy. Toxins, whether it's chemical, heavy metal, mycotoxins, adjuvants, such as, the adjuvants are what they put in vaccines to stimulate your immune system to go after something. These, of course, they're triggers. The whole point of adjuvants is to trigger your immune system to go after something to make an immune response. The only way that a vaccine will ever go to, get approved is if it proves that it creates an immune response. So they have to add these adjuvants, mercury, aluminum, to get your immune system to go after the trigger, to go after whatever it needs to go after. So heavy metals, chemicals, mycotoxins are so annoying, because I think anybody that has an autoimmune disease should get a mycotoxin urine test. And then ultimately it's like, okay, what are you going to do now? You're going to track it down and fix it. But these are serious issues that chronic mold exposure will cause autoimmune diseases and various health problems. And, it's not going to get diagnosed unless you're going outside of the insurance-based world. Infections. Viral infections, bacterial infections, parasitic infections, all of these are triggers. Now, if you have a really healthy immune system, meaning, you're sleeping well and your, gut microbiome is good and you've got plenty of nutrients and vitamins and you have enough things moving in the right direction, then you can get some of these triggers and they don't actually turn into full-blown triggers that create an autoimmune disease. So not everybody that is exposed to the same chemicals will develop the same autoimmune disease or an autoimmune disease at all. Some will, some won't. Maybe some people that develop like cancer, something totally different. Everybody's different as far as how they react to various environmental triggers. Nonetheless, we know that these stimulate the immune system in a dangerous way, and we've got to really be aware of them and find ways to test, quantify, and protect ourselves from these things. Now I'm going to come back to my celiac topic today, because I just kind of talked about it and then I moved on and now I'm back. So celiac disease, if you look at what celiac disease is, then you basically see that it's destroying the intestinal lining in many people, but not everybody. But if you look at on the left, this is a normal intestinal healthy lining where you have this nice intestinal villi that has a nice large surface area. And that nice large surface area allows for proper absorption of nutrients, so you don't become nutrient depleted and low in vitamins and fats and minerals and all that stuff. Because if you don't have this nice intestinal villi with all this extra surface area to absorb nutrients, then you are going to become low in vitamins, fats, nutrients. And then with celiac disease, ultimately it creates a lot of problems, but often it will create this villus atrophy, which means that you don't have the intestinal villi. And this is where celiac disease, as if it wasn't already complicated enough and hard enough to diagnose, it really ups its game. And the reason it ups its game and makes it that much more of a clinical chameleon is because now these people that don't have the intestinal villi that they need, they don't have the surface area to absorb nutrients, they become nutrient deficient. They become low in vitamins, minerals, fats, everything. Now, we live in a world where clinicians are not good at diagnosing nutrient deficiencies. And unfortunately, we also live in a world where a lot of people have nutrient deficiencies. Trust me, I nearly died from pellagra in my 20s. It's vitamin B3 deficiency. It is common. It is commonly undiagnosed. And, my parents were both in the medical field. My father was medical doctor, pharmacist. My mother's pharmacist. Went to the doctor, all that good stuff. And I nearly died of pellagra in my 20s. So this happens. Trust me. Nutritional deficiencies. We need to get better at diagnosing them. But celiac disease, going back to it, this is a clinical chameleon. It can look like just about anything because this disease does not just attack the intestinal lining like a lot of people think. Most people think if you have celiac disease, you're going to have diarrhea, digestive problems, and often people don't even realize it could cause constipation, not just diarrhea, digestive pain, etc. But celiac disease, it actually affects the entire body. This is an autoimmune disease that can affect your brain, your skin. It can affect every single organ in your body. And it, in many cases, doesn't appear even on microscopic examination to affect the digestive lining while destroying other parts of the body. It's an autoimmune disease. It is not an allergy. Okay, I'm going to go through the exact test to diagnose the allergies versus the autoimmune diseases. This is not an allergy. This is an autoimmune disease. So it's important to understand that. There are environmental factors. Gluten is clearly the big trigger here, but and then there are genes. There's two key genes. The two key genes are HLA, DQ2, and DQ8. I'm going to discuss those in a second. Now, I want to first spend a moment to kind of talk about how did we discover celiac disease, because it's an interesting story and it didn't really happen that long ago. But basically, during World War II, during, the big famines in the Netherlands, there were famines all over, especially Europe and, Russia at that point in time. But in the Netherlands, they were not getting food. And what happened was there were these orphanages where they were starving, they were famished. But they realized that the adults who were watching over these kids, they realized that some of these kids were thriving in a nutrient deficient environment. And the difference was that they were not getting any bread. They were not getting anything. They were eating tulip bulbs. And so they eventually, food came back and they got the gluten again. And then these kids that started thriving during a famished environment, they reverted back to their unhealthy selves. And then this was really an aha moment for some of these people, the scientists and the people who were watching, and they realized, okay, it's gluten. And then that was really where they learned to look closely at the gluten piece. And so, during the process of really figuring this out, there was a period where they thought that the treatment was unripe bananas, which are gluten-free and, help some people. But, putting these people on this diet of unripe bananas was not really a good long-term solution, but that was something that they did for a while. So, who knows what we'll be talking about in the future as far as looking back at 2023. Look what they used to do. They used to whatever. So, okay. Here's a map of areas that are largely affected by celiac disease. It certainly affects the Caucasian population largely. Ireland, Finland, northern Italy, large percentage there, even northern India. That's probably partly because of the colonization of India from European countries, UK. Germany although they have a fair amount of celiac gene there, they're actually less likely to develop celiac disease than other European ancestries. I don't know why that is, but it appears to be true. Maybe it's because they eat so much sauerkraut. I don't know. However, this gene is, very common in America and pretty common throughout the world. It's important. 30 to 40% of the world has one of the celiac risk alleles. So it's a large percent of the population. We'll talk more about that in a second. So here's the categories: celiac, gluten sensitivity, and wheat allergies. So celiac disease, autoimmune disease triggered by gluten. Okay, these people, the treatment, avoid gluten: wheat, barley, rice, spelt, kamut, conventional oats. Gluten sensitivity. Gluten sensitivity isn't technically an autoimmune disease. This is more technically a sensitivity, but this is an IgE. I'll show you the labs in a minute. This is an IgE reaction to your immune system is going after gluten rather than your immune system going after the tissues of your body, which is an autoimmune disease. It's going after gluten. Still bad, still creates a lot of health problems, often leads to celiac disease. Gluten sensitivity is often the early, onset, and then if left untreated, will progress to celiac disease, which is why you want to diagnose and put these people on a gluten-free diet ASAP so that you prevent them from going into that autoimmune category, because celiac disease, autoimmune diseases, once you enter that world, you're in the management world. You're in a world where now you have to really monitor your health in a different way than somebody without an autoimmune disease. Again, the treatment is the same. Must avoid wheat, barley, rice, spelt, kamut, conventional oats. Wheat allergy. Okay, wheat allergy, your immune system is making antibodies to go after wheat rather than gluten. Different molecular structure, same treatment plan for all three of these categories. Same treatment plan. Wheat allergy, gluten sensitivity, celiac disease. They're all treated the same. It is an allergic reaction with wheat. Wheat allergy, they're going after the wheat. Gluten sensitivity, immune system's going after the gluten. Celiac disease, immune system is being triggered by gluten to go after the body. All of these treated, gluten-free diet. How many people need to be on a gluten-free diet? Okay, this is not like a fad that's going away. The reason that you keep seeing more gluten-free options, seeing more people get on a gluten-free diet, is because this is really a layperson-driven diagnostic change in our the foods that people are demanding, because people feel better on a gluten-free diet. And unfortunately, the medical system has not been driving this the way that they should have and could have by diagnosing and recommending a gluten-free diet as they should have, because they live under this misperception that celiac disease is rare, and they have kind of like an archaic understanding of how to diagnose it, which we'll talk more about in a second. So, but it's really not as rare as you think it. Many people think it is. And if you combine celiac disease with a wheat allergy or gluten sensitivity, then about 10% of the population has one of those things. Like I said, all three of those issues, whether it's celiac, wheat allergy, or gluten sensitivity, they're all treated the same way, which means that about 10% of the population is going to, if they're really trying an honest gluten-free diet, will feel better on a gluten-free diet. If they're trying 100% gluten-free diet and really aware of how they feel and how it can affect their health. Okay. Now, the stats are, it's believed that 1 in 133 people, some would say 1 in 100 Americans, have celiac disease. Okay. But only about 10% of those people are getting diagnosed. So most people that have celiac disease, and you can throw gluten sensitivity and wheat allergy in that category too, most people that have these issues are not being diagnosed. So we have a huge undiagnosed population, and this often creates this misperception that it's really not that common, when in fact it is much more common. So but 9 out of 10 people who have celiac disease are undiagnosed. Now, this disease really reminds me of hemochromatosis, which I'm not going to spend a ton of time talking about that today, although I could. Those of you that know me know that, I have the Iron Curse book that I'm about to publish, and I talk a lot about that in that book. But hemochromatosis is a disease that it on average takes like 10 years for people to get diagnosed. Those people that are diagnosed, only about 10 to 20% of people that have the disease get diagnosed for hereditary hemochromatosis. Celiac disease takes on average about 10 years from the onset of symptoms for people to get diagnosed. Those people that are diagnosed, on average, it's, about 10 to 20% of the population. So they mirror each other very similar. They also have these key genes that allow us to screen the population. There are also, very readily available tests to help us diagnose these diseases. And there are very readily available environmental changes that can help really change the outcome of these diseases and help people so that they don't have health problems related to these diseases. Okay, so some of the hidden dangers of undiagnosed celiac disease, because this is, if you have one of these genes, if you have celiac disease, you're more likely to have pretty much any autoimmune disease. But what are some of the symptoms that can kind of be the hidden symptoms of this disease? Well, it can be fatigue, asthma, from just inflammation, asthma, anemia, whether it's low B12, low iron, low B9, hair loss, that's largely from nutritional deficiencies, abdominal pain, inflammation in the gut, behavioral problems, that can be inflammation in the brain, that can be also nutritional deficiencies, menstrual problems, that could be nutritional as well. It could be a number of different things. In some people, they'll actually get autoimmune antibodies to their ovaries triggered by celiac disease, just because they're more likely to get autoimmune diseases. And then that can create a lot of menstrual problems. Pregnancy problems, dental enamel defects, a lot of this is nutritional, chronic sinusitis, sneezing, this is just inflammation, immune system's overreactive. Go underneath the surface a little bit, might see some tremors, especially with celiac disease. It's affecting the cerebellum, as in gluten ataxia. So if you have gluten ataxia, then your immune system's destroying your cerebellum. And if your immune system's destroying your cerebellum, then you're going to get, more likely, not in all cases, you're going to get an intention tremor, which is where, so a resting tremor is where you have a tremor when you're at rest. Like if I'm sitting here resting and I have a tremor, like that's a Parkinsonian tremor. If I have an intention tremor, like I'm going to touch my nose, and when I touch my nose, I'm intending to do something, and then I have a tremor, that's an intention tremor. Okay. A resting tremor, I have the tremor when I'm resting, but then when I go to touch my nose, I'm okay. Those are two different types of tremor, and it's very diagnostic. So if you see somebody with a resting tremor, that's more Parkinsonians. If you see somebody with an intention tremor, that's more cerebellar tremor, autoimmune cerebellar disorder. It can often be from a gluten ataxia, gluten triggering an autoimmune disease to attack your cerebellum. Put these people on a gluten-free diet for a minimum of 4 weeks, potentially longer. Get celiac genetic testing on these people. I'll talk more about that in a second. You'll also, with these people that have the tremors with gluten ataxia, they'll have a wide-based gait because they can't, when you have cerebellar issues, your balance is often bad. They'll have poor balance. If you have them, stand with their feet together and their eyes closed, they might not be able to do that, or they might sway really bad. Or they might say, oh no, I'm not doing that. Or they might close their eyes and they might fall backwards. So you got to be there ready to catch them. This is a cerebellar issue. They do not sense, and their proprioception is bad. When they walk down the hallway, you walk behind them and you see that they're walking kind of like they have this, what's called a wide base cerebellar gait. It's almost like a drunken gait, because when people drink alcohol, it also affects their cerebellum, and then they walk with this wide gait. Well, when your immune system's destroying your cerebellum, you have a hard time walking, and you're more likely to fall. And so your brain makes you walk in a larger, wider gait so that you're more stable, rather than walking in a normal, more narrow gait, which is less stable and requires more sensory proprioception and a healthy cerebellum. Okay. So also, undiagnosed celiac disease, increased risk of cancer, whether it's, lymphoma, digestive cancer, stomach cancer. Look for these things in the family history. Increased risk of epilepsy, diabetes, dizziness, diarrhea, gas, bloating, migraines, weak bones. Why weak bones? Malabsorption, not getting the nutrients they need, mental illnesses, muscle and joint pain, neurodegeneration, whether it's Alzheimer's, Parkinson's. Add that celiac issue to any other environmental genetic issue, and you just threw gasoline on the fire of a neurodegenerative disease. You have more inflammation. More inflammation creates more health problems. Any autoimmune disease you're more likely to have if you have celiac disease or a celiac gene. Excessive weight loss or weight gain. And some of these people, they have weight gain, folks. I know it doesn't seem like that could happen. It's counterintuitive. It can. And that's largely water weight. That's inflammation weight gain. Okay. Leaky gut, reoccurring mouth ulcers, ADD, ADHD, food allergies, thyroid disorders, skin rashes, poor balance, chronic inflammation, numbness and tingling, and short stature. They're not growing because they don't have enough nutrients. All right. So moving on. Slideshow. Slideshow won't let me move on. Okay, there we go. All right. Celiac disease is not just a digestive disease. Again, I just said all of this, and there were a couple things I didn't have on that list that you need to know about. You can read this. I basically copy and pasted this from my first genetic testing book. Things like depression, pregnancy problems, white matter lesions on the MRI. A lot of issues here. Infertility. Some studies show that 2/3 of people with celiac disease have their symptoms manifest as neurological problems without having intestinal or digestive problems. So, like I said, I believe my mother, who I got my celiac disease, my celiac gene from, had undiagnosed autoimmune encephalitis, diagnosed as schizophrenia. Yes. Was she schizophrenic? Yes. But was that triggered by her immune system attacking her brain and creating massive amounts of inflammation? Did she ever have digestive disorder issues? No, she didn't have digestive issues that she knew of or anybody else knew of. Does that mean that she didn't have celiac disease? No. Here's dermatitis herpetiform. Yes, this is a dermatological manifestation of celiac disease, and it's really uncomfortable, folks. So it often does not get diagnosed. I found, this often does not get diagnosed. Dermatologists are not great at it. And I had a conversation about that with my relative, and it did not go as I had hoped. Let me just put it that way. Here's the celiac genes. So the two celiac genes are, here they are. They're called HLA-DQ2 or HLA-DQ8. And the risk alleles, get your genes, folks. Look at these genes in your patients, all of them. If they have one risk allele, you need to have a serious talk with them about this. And any health problem that they have, you need to discuss how it can be related to celiac disease. And if you don't know, then just go and research and Google that health problem as celiac disease, and then you'll make the connections and you'll find them. I had a patient come in a while back, and she actually was referred by her brother. Her brother came in. He developed some digestive issues after from COVID. And he happened to have his 23andMe. So I just, was like, hey, can I just see what you have? He was kind of like, why are you asking me this? I'm not sure about you. But he did have a celiac gene. And I discussed how, this celiac disease is more likely when you have this gene. Almost everybody that has celiac disease has one of these genes. And this is a genetic, this is an autoimmune disease that often gets triggered by a virus. And so he goes on a gluten-free diet. He gets better. He's happy. He refers his sister. His sister comes in. I don't have a lot of, to go on other than she has like this one like joint at the end of her finger hurts, and she doesn't have as good of range of motion as she likes. She's really young. She's in her 20s. She's gone to multiple doctors. She's had a steroid shot. It didn't help. She's had x-rays, normal, all the blood tests, no RA, lupus, etc. She went to a chiropractor. They actually didn't touch her finger or adjust it, which is weird. But she didn't like how they were trying to sell her a big treatment plan. So she came to me, and I did adjust it. But I also said, hey, what's your family history like? Because I know I'm concerned about celiac issues. And she said, well, I had this grandmother who had arthritis. I'm like, what type of arthritis? She's like, well, I don't know. I asked her, did her hands start getting kind of weird looking? Yeah, they started getting really weird looking. I'm like, well, that's probably rheumatoid arthritis, because rheumatoid arthritis differs from osteoarthritis, and that your hands start really getting kind of warped looking often with rheumatoid arthritis. And rheumatoid arthritis is an autoimmune disease, whereas osteoarthritis is not. And so I said, okay, well, I'm concerned about, the celiac gene potentially you might having one. And now it looks like somebody in your family might have had rheumatoid arthritis, which can be caused by celiac disease. And I just think, why don't you go on a gluten-free diet and let's just see if this pain goes away. And so she goes on a gluten-free diet, the pain goes away. And then she goes off the gluten-free diet and the pain comes back. And then she goes back on a gluten-free diet and the pain goes away. So now we know, okay, this young lady who the worst problem she ever had was pain in the tip of her finger, now has potentially avoided like a huge genetic landmine, like potentially avoided like rheumatoid arthritis, who knows what else. And that's because, we caught it early. And the reason we caught it so early is because I was lucky enough to see that her brother had a celiac gene, and I had that information to go off of. So turns out she does have the celiac gene. Her labs look perfect. She didn't have like hardly anything wrong on our labs other than, low vitamin D, which is so common. You can't really get that excited about it. She did have low iron. That's also because she has this long, really heavy menstrual cycle that needs to get better. The point of the story is that you need to look at these genes because sometimes they are the only tool you have to convince people to try a gluten-free diet, and then ultimately to find out through that gluten-free diet that they really need to be on a gluten-free diet and that it's going to dramatically help their health. But you have to be able to connect the dots to them, because a lot of people, they can't get there without your help, and they want to get there. They want to be healthy. They'll do the work, but you have to help them connect the dots and get there. So anyways, I digress. Let's go back to the slide. HLA-DQ2, more likely to get celiac, lupus. So this gene is present in 30% of the U.S. population. If you combine these two genes, it's 30 to 40% of the U.S. population has one of these genes. It's said that having one of these genes is only present in about 50% of patients with gluten sensitivity. I don't know if that's true or not, but certainly if you have one of these genes, you are much more likely to get gluten sensitivity, which if you get gluten sensitivity, you're more likely to get the even worse condition of celiac disease. So the HLA-DQ8, it is also celiac, rheumatoid arthritis, type 1 diabetes. This is a big one, folks. We need to really be screening for this because type 1 diabetes is no bueno. If we go back up to the HLA-DQ2, this is the most common one. This is just a much more common gene than the HLA-DQ8. Both of them are very problematic. Okay, so you also have an increased risk of, with this HLA-DQ2, what's called refractory celiac disease, which is where you put people on a gluten-free diet and they don't seem to get better. And that's where you have to really dig in your clinical heels and say, we are not going to give up on this gluten-free diet, and we are going to heal up your gut. We are going to heal up your microbiome. We are going to give your body a chance to heal, and we are not going to give up just because it's been 4 weeks. You have the genotype where you might have refractory celiac disease. This is what it is. We're not giving up. Come on. And then these people are also more likely to have enteropathy-associated T-cell lymphoma, cancer. Not fun. So, maybe this girl that came in that had this annoying, finger that hurt is preventing T-cell lymphoma. I don't know. It's possible. Moving on. Some of the misinformation that the National Celiac Association is spreading. They are saying that people who have only one of these DQ2 or DQ8 genes have a risk of about 3% of having celiac disease, whereas people that have 2 copies are only about 10%. Folks, I can't give you the accurate number. I can just say it's higher than that, because I've been looking at these genes and these patients, and I'm working with, and I'm really trying here. And I'm telling you that if you have one of these genes, especially if you have 2 of these genes, you're at a very high risk of having celiac disease. Why is the National Celiac Association saying these numbers are true? Well, because they're out there. These are the stats that are out there. Why are these stats out there? Because people aren't getting diagnosed. They are not getting diagnosed. If you really want the right diagnosis, as far as the stats, as far as these people, get 10,000 people, do a huge study, put them on a gluten-free diet, and do all of these tests ahead of time. But also, one of the tests needs to be put them on a gluten-free diet, see how their health improves, and then let's see how many people really have celiac disease. Let's do the diagnostic testing, which I'll talk about in a second. Also try the other diagnostic test, which is a gluten-free diet, and then see how many people really have a problem. And then the other misinformation piece that they are spewing is rarely do people with only one of the DQ2 genes get celiac disease, but this occurs in less than 5% of people with celiac disease. So it's not rare for people with only one DQ2 or only one DQ8 gene to get celiac disease. This is where this topic really mirrors and echoes my hemochromatosis talk, which is there's this myth that if you only have one of these genes, you're safe. And that's a myth, and I just want to blow it out of the water, and I need you guys to help me. So here's some of the diagnostic testing, because I don't have a ton of extra time, and I want to, talk about some other things other than celiac disease. I'm not going to talk about every single thing here, but I'm going to scan over it. So you cannot diagnose gluten sensitivity or celiac disease with genetic testing alone. That does not mean that we preclude genetic testing. The genetic testing needs to be done. The genetic testing could potentially be the earliest way to help diagnose somebody at an early age, especially. Ultimately, there's other steps that need to be done to really figure out if gluten's the problem. But genetic testing needs to be a part of that. But just because somebody has one of these celiac disease genes does not mean that you can tell them you have celiac disease. It means they have the gene, not technically the disease yet, maybe. Or they could have the disease, but you didn't just diagnose it based on the gene. The gene means that they have a genetic predisposition and are at a high risk for having the disease, and that you need to keep a really close eye on them and educate them. And they need to be looking closely, not just for themselves, but for all of their relatives they're related to genetically. Intestinal biopsy is like the gold standard back in the day, when, it's more of an archaic way, although a lot of gastroenterologists still like to do that. It's really, in my opinion, very archaic. Basically, the intestinal biopsy is that you are on this diet where you're eating gluten, and then the gastroenterologist does an EGD, and they take a biopsy of the first part of your small intestine, which is called the duodenum. And then they look at that underneath the microscope, and they say, oh, you have atrophy of your intestinal villi, like what I showed in that first picture. So you have, you might have celiac disease. And so we're going to put you on a gluten-free diet for however long, let's say 3 months. And then we're going to have you do another EGD, where you're going to look down your throat and take another biopsy. And we're going to look underneath the microscope, and we're going to see, oh, you have intestinal villi back. Okay, you have intestinal villi back. So now we know for sure you have celiac disease. That's a lot of testing. It's making it, I think, much harder for people to be properly diagnosed than they should be. So I'm not a huge fan of the intestinal biopsy test. Also, what did I just say, folks? A lot of people that have issues with celiac disease have celiac disease. It's not affecting their digestive lining. So if this is an important diagnostic test, well, it's missing an important part of the population. So you know what? I'm not saying there's not clinical value, but I think that we need to really look closely at the other options too. What are some of the other options? Well, you can do blood tests where you can look at the big three antibodies: anti-tissue transglutaminase antibodies, anti-endomeasial antibodies. You can do IgE or IgA for these, or the deaminated gliadin antibodies. If you have any of these, IgG or IgA, you have celiac disease. End of story. If you're going to do an IgA test, you need to check IgA levels. If they're low in IgA, well, then your IgA test is trash, and it's going to be potentially a false negative because there's not enough IgA in the body to give you a positive test. For the gluten sensitivity test, you're looking for the anti-gliadin antibodies, where they're looking to see, is the immune system attacking gluten specifically? You can do an IgA or an IgG. Those are gluten sensitivity. Okay. Wheat allergy, you're looking for IgE, IgG, or IgA for is your immune system going after gluten, creating antibodies? All of these tests must be done while eating gluten to get a positive finding for 2 to 3 weeks minimum. The food elimination test is one of my favorites. Not only is it inexpensive, it's extremely accurate if the patient follows it correctly. And that is that you avoid gluten 100% for at least 1 month, in some cases longer. For neurological type issues, it can be much longer. 100% so that you can see how your health improves, and then get back on gluten and see how your health declines, and then get back off gluten and see how your health improves. That's basically it. Now, I understand the need to get these other tests done, like the blood test. When my daughter came to me and she was 4 years old and in preschool and telling me her stomach hurt, I was like, oh, child, I'm going to have to take you off gluten. And that just made me sad. And I knew that that was going to be what needed to happen, but I also knew that I needed to have some paper proof for my husband and my relatives and the school to say, my daughter has a problem and she's going to be on a gluten-free diet, and I need you guys to be on board with this. And so, we did the whole testing. It came back. She has gluten sensitivity, got her off of gluten. Her stomach pain went away. And, that's a common story. She does have a celiac gene. I gave her, bless her heart. So here's some additional labs to consider, which I'm not going to go over right now because I have a couple other things I want to talk about. So, I'm skipping some slides here. Those slides, the most important thing about those slides was that ALS is actually something that can get misdiagnosed. People who have celiac disease, often it presents, not often, but in some cases it presents as ALS. So that's just one of those things that I think is kind of surprising to a lot of people, that this, terminal neurological disease, ALS, can actually be reversed if correctly diagnosed as celiac disease. Interesting. And this study is basically showing that the intestinal microbiome and probiotic is really key for celiac disease prevention. So if you're eating gluten and let's say you have bad gut microbiome, then you're more likely to develop leaky gut and more likely to then develop an autoimmune disease. Now, what the research shows, not surprisingly, is that especially lactobacillus and bifidobacterium, not only do they they decrease the risk for leaky gut. They also decrease the inflammatory cytokines, decrease inflammation, decrease the risk for autoimmune diseases. I don't think that's surprising, but if you would like a reference, then just go PubMed this article, and you will have that to share with your friends and family. Here's an article that shows that if you not only is prebiotics and probiotics really crucial for prevention of celiac disease and autoimmune diseases, but there's also, the gluten digestive enzymes that can decrease gluten in the blood. And so the Aspergillus niger is where a lot of this DPP4 comes from. And what they're saying is basically that they're showing that the placebo who did not get that enzyme, they had much higher doses of gluten. So in their stomach and duodenum, their intestines. So these people show, in this case, these rats had much lower levels of gluten from taking this enzyme. Those enzymes are helpful. I personally take them whenever I'm going to eat out, especially, or traveling, just from incidental exposure to decrease my risk. It's something I found to be helpful personally and clinically. Now I want to use what's little less of my time to go over a couple other genes and how iron affects the immune system. Bear with me now. This is the home stretch. Don't leave me. It's really important. So what I want you to understand is that when you have high levels of iron, it will make you more likely not only to have inflammation and autoimmune diseases, but also more likely to get infections, because iron is like fertilizer on infections. Infections thrive off of iron. And so the immune system knows that, and the immune system has a brake on iron absorption, and that brake is called hepcidin. So whenever iron levels are high, or if you're really inflamed and you're dealing with an infection, your immune system will tell your liver to make more hepcidin, and then that hepcidin will go and it will break down the ferroportin transport proteins, which will stop iron from being able to transport out of the intestinal cells, so you cannot absorb it from the intestines. In the next slide, I'll show you how it also, decreasing the ferroportin transport proteins, also will decrease the ability for iron to leave the liver and the macrophages. Okay, so what does this mean? This means that you're not going to be absorbing as much iron, which will make you have lower levels of iron, so that your immune system can get a handle on the infection. But you'll also have higher levels of ferritin in the liver, and then you're going to have more iron in your macrophages, which is going to set you up for immune-related issues, because these macrophages are going to get extra inflamed because of all that iron, and they're going to, when they get really inflamed and angry, they're going to be more likely to create immune issues like mast cell issues and autoimmune diseases, and just in general bad immune issues. The extra iron that's in the digestive lining, people with really high iron, they often develop digestive issues as well. And eventually this iron will slough off and be removed in the bowels. But this is really crucial to understand. So if you have high levels of inflammation, then your immune system, if you have a lot of inflammation or if you have an infection, your immune system is going to create more hepcidin to decrease iron absorption. And then that can create low iron and blood work combined with high ferritin, which is called anemia of inflammation. Okay? Now, people that have the hemochromatosis genes, they make low levels of hepcidin regardless of how much iron they have in their body, and they don't have brakes on the ability to absorb iron. And that is one reason they become high in iron, and that's one reason they're more likely to have serious infections, often fatal infections. And that is one reason why they're more likely to have inflammatory issues and autoimmune diseases. As far as the immune system and high iron, more likely to have infections, more likely to die from eating uncooked shellfish due to a bacterial infection called Vibrio vulniferus. 50% mortality rate from that, more likely to have long COVID and severe acute COVID that is deadly, more likely to have autoimmune diseases, more likely to have spleen damage. Spleen's an important part of the immune system, increased histamine, allergies, mast cell, urticaria, all that fun stuff. I'm almost done. I'm just going to show you some slides because I love you. Bear with me. Here are some genes that are important for vitamin C. Here's some genes that are important for vitamin D. And then here's some more genes that are important for vitamin D. And that is all, folks. I have my upcoming book and my old book, and I'd love to keep in touch. So thank you for your time, and I'll see you guys next time.